5, 4, 3, 2, 1. Today is Tuesday, August 16th. It is the Public Health and Safety Committee. We have a quorum with Evans, Gamble, Nash, Pulley, Rosenberg, and Taylor. Do you have a consent agenda? Basically everything up until bills on second reading. So I'll read the captions, and if anybody needs to pull anything off, we can do that. RS 2022-1704, Allen, Evans, and others, approves Amendment 1 to a Project Safe Neighborhood grant from the Tennessee Department of Finance and Administration to the Metro Nashville Police Department to reduce gun violence in Nashville. RS 2022-1707, Allen, Evans, and others, approves a grant from the Tennessee Department of Health to the Metro Board of Health to use available data to identify populations at high risk for adverse consequences from substance abuse and employ evidence-based interventions that are responsive to population needs. RS 2022-1708 approves a grant from the Tennessee Department of Health to the Metro Board of Health to promote the proper use of all recommended vaccines and respond to vaccine-preventable diseases in collaboration with the CDC and other partners. RS 2022-1709, Allen, Evans, and others, approves a grant from the Tennessee Department of Health to the Metro Board of Health to provide an array of programs and direct patient care services to meet the public health needs of Tennessee's citizens. RS 2022-1710 approves a grant from the Tennessee Department of Health to the Metro Board of Health to ensure federal preparedness funds are directed to Tennessee regional and metropolitan emergency preparedness programs to prepare for, respond to, and recover from public health threats. RS 2022-1711, Allen, Evans, and others, approves a grant from the Tennessee Department of Health to the Metro Board of Health to provide oral disease prevention services for school children in grades K through 8 in qualifying public schools. RS 2022-1712, Allen, Evans, and Welsh, approves a grant from the Tennessee Department of Health to the Metro Board of Health to provide viral hepatitis program services aimed at prevention, testing, diagnosis, surveillance, and linkage to treatment and other support services. RS 2022-1713, Allen, Evans, and others, approves Amendment 1 to a grant from the Tennessee Department of Health to the Metro Board of Health to provide HIV/AIDS core medical services and early intervention services. RS 2022-1714, Allen, Evans, and others, approves Amendment 1 to a grant from the Tennessee Department of Human Services to the Metro Board of Health to conduct immunization record audits for child care centers, drop-in centers, and group child care homes to ensure the safety and well-being of children and families in Tennessee. RS 2022-1715, Allen, Evans, and others, approves a grant from the Friends of Metro Animal Care and Control to the Metro Board of Health to provide funding for emergency medical care for shelter animals, the Safety Net program, and to foster behavioral support training. Does anybody need to pull anything off? Do I have a motion?
So moved.
All right, it's been moved and properly seconded. All those in favor of our consent agenda?
Aye.
Anyone opposed? All right. Move approval, 6 in favor, 0 against. We will go to bills on second reading, and we will skip to BL 2022-1385 on page 5. This is by Mendez, Sledge, Withers, and others. Amends section 13.08.080 of the Metro Code pertaining to the use of license plate scanner technology to exclude assisting with enforcing laws outlawing abortion or outlawing interstate travel to obtain an abortion as an allowed use of LPRs. Do I have a motion?
Second. Moved. Second.
Okay, it's been moved and properly seconded. I'll recognize the sponsor.
Thanks, Chair. So under the current LPR law that we've got, LPRs may be used for, and I'm reading, investigating and prosecuting felony offenses and criminal offenses associated with violent crime, including homicide. We also know in the post-Dobbs world where Roe versus Wade has been overturned, many states that outlaw abortion already have fetal homicide laws on the books. In May, a few months ago, the legislature in the state of Louisiana introduced a bill to expressly make abortion equal homicide. And at least a dozen states already have laws making performing an abortion a felony. So legal experts say, and common sense for anybody who's paying attention to the media would indicate that law enforcement in some state, probably in the South, is going to be asked by civilian leadership to try to enforce abortion-related felonies. And currently, our LPR law would authorize assisting with that if a car associated with that was being looked for. So the solution, if we're going to live in this, what I frankly would consider repressive, anti-woman, inhumane arrangement where there's the criminalization of reproductive health procedures, including abortion, it needs to happen without our LPRs in Nashville. And so given the current state of the law, we would need to add to the list of disallowed uses of LPRs to say abortion-related criminal offenses are not an allowed use. And already, you guys probably remember, baked into our current law, if an outside agency wants access to our LPR data, they have to state the purpose already. That's already in the existing law. And so if the reason was abortion-related offense, then our LPRs would be not fair game for that. So with that, I'm happy to answer any questions and would request the committee recommend approval.
All right. You have your hand raised, Councilmember Nash.
Gosh, yeah, I think it's important to know that currently in Tennessee, traveling out of state for reproductive services is not illegal. Now, what the legislature might do come this next month, and I just have a little concern that there's already enough anxiety out there over this Dobbs decision, and I'm not sure that we don't just kind of add to this every time we come up here with another bill. So currently, at least as far as Tennessee goes, we wouldn't be enforcing this because it's not against the law to do.
Well, the question would be whether it's against law in other states.
I hear it. Good point. Police Department council have any concern one way or the other?
I don't have anything.
Yeah.
All right, Councilwoman Gamble.
I appreciate the sponsor bringing this forward. I think it's a good idea to be proactive and get ahead of any pending legislation that the state may come up with. My question is, does this impact any federal changes in laws? If something changed federally where it was illegal to go to another state for an abortion, would this action prohibit still the use of LPRs for that?
Well, I think practically speaking, that wouldn't be a concern for at least the next 2 years, because I think if, the worst thing that'll happen worst thing from my perspective, after the midterm elections would be Congress and the president would be split. And so the idea of passing a law like that federally seems highly unlikely over the next couple of years. And if 2.5 years down the road, both houses of Congress and the presidency are in the same hands and pass a law like that, it would simply preempt the law that we had on the books here. And the only other thing I would add in response to Councilwoman Nash's point, which is a fair point, is recent events over the last couple of years indicate that the city of Nashville will get punished by the state for good reason, bad reason, no reason. We ran the best COVID program in the state, and our prize for it was to have our health department stripped of all power. And that one, there's nothing we would do different about how we handle COVID, I don't think. And we got smacked down by the state over that. If rumors are to believe, we're going to get smacked down for the RNC decision that was unanimous, or I guess it wasn't unanimous, but it was strong. We're never going to get, I don't think, I would submit, we're not going to buy ourselves into good treatment by the state by guessing what happens to us on abortion-related things. I think that in this era where being really blunt about it, the Trump-appointed majority in the Supreme Court killed off a right that's existed for 50 years, and most of the states in the South are intent on also squashing that same right. That leaves it to cities, if there's any place to demonstrate a woman's right to choice and a woman's right to have access to health care decisions. If there's any level of government in America, or at least in the South, that's going to demonstrate that it's at a city level. And I think it's incumbent upon us to we're already in the worst-case scenario for women's rights on that. It's been 50-year rights have been stripped away. It doesn't get worse by trying to take very reasonably foreseeable events, and try to get ourselves in a position to deal with it. I know reasonable people can disagree about that, but that's my view of it.
How about other, Councilmember Nash?
Point taken, well taken. But I think we're at the point where we've really got to start focusing on the state legislature, begin suggesting what would be an acceptable policy. I think currently, especially the law that goes into effect, the 25th, is just crazy. And to come up with something that's reasonable, medically supported, and something with reasonable timelines and the like, and that's where the solution's got to be. And I sometimes think, well, we're doing this over here, we're not focusing people's attention where it needs to be, and it's got to be, that's where it's going to be solved.
Councilmember Rosenberg?
Thank you. The legislature is not going to be reasonable, and there's nothing we can say to change it. They're not.
Not this one, but
No, and it's going to.
I'm hoping that this might be one of those issues that forces maybe some different elections.
And to that end, the only way it gets forced is if popularly elected people in cities take positions and bring issues to a head.
Any other questions?
Just briefly, I want to get a couple things on the record here. Just a question for Commander Gilder. Is there any intention on the part of the police department to enforce abortion laws at all?
It's my understanding the district attorney's already taken a position that he wasn't enforcing that. We've, to my knowledge, not been asked to take any kind of enforcement on that, and I don't recall us ever making an arrest for that offense.
And I'm just curious as to how LPR data can aid in the enforcement.
I can't really envision a scenario where we could use LPR data for that. I mean, obviously it's locational, right? I mean, I guess it might prove you were at a particular location, doesn't prove what occurred at a location. So, but
And
I don't know. Not really thought that through.
To the sponsor, if you have an answer.
Yeah, I think if you read statements from legislators in Texas and Louisiana in particular, like there's a group of state legislators in Texas that wrote a very aggressive letter to the Sidley and Austin law firm that essentially threatened criminal prosecution for Sidley and Austin aiding their employees to cross state lines to get abortions, and multiple states that have passed it's a felony to provide an abortion are expressly aimed, according to quotes from state legislators in these states, that if there is evidence that X doctor has suggested to Y patient that she crossed state lines, there's an active intent from some of these states to track down and prosecute anybody who's been aiding in the process. And the leap to, and she's driving a Dodge Neon, or I don't know what, some car with XYZ plate, and they're headed to Illinois because abortions are legal in Illinois. The leap to that, of course, it hasn't happened yet because it's been a federally protected civil right. But there are active state legislators who are coming up with how they can have a constitutional way to keep people from crossing state lines, and criminal prosecution is what they're talking about.
I certainly get the idea of getting ahead of any criminal prosecutions as it relates to this. The DA may change, the police chief may change, police policy may change. I get that. I'm just curious as to how the LPR data would assist in this.
Yes, there was one other thing I meant to mention, sorry. Like, I have a lot of faith in our DA here, what he said, but the scenario isn't our DA prosecuting. The scenario is that The
DA in the other state.
Timbuktu County DA in Texas,
And using our,
and they submit a request to use our LPR saying we have, it's investigate or prosecute is our current law. We're investigating whether Miss Susie Smith is engaging in a felony for committing, participating in abortion in another state. We're looking for this car. And under our current law, if that eventuality happens, we have to participate because it's a felony involving homicide. And under Texas law, it's considered a homicide to engage in an abortion.
okay, appreciate that.
Any other discussion? All right. You renew your motion?
Well, yeah, I move.
Thank you. All right, all those in favor?
Aye.
Anyone opposed?
I'm going to abstain.
Abstain? All right.
Vote against the position, abstain.
With one abstention, we move approval. Looks like they're having a little conference outside. Thank you. Could you see if they're ready to come in, Councilman Syracuse? All right. Wrap it up.
Don't leave.
Oh, yeah, where's Russ?
Russ.
Yeah. Yeah.
Well, Welsh is out. I saw Welsh.
You're good
Don't
with
leave. I mean, is he coming back?
Councilman Hollins decided to bar the door so a quorum can't get in here.
I just had to get somebody chair.
Now we're back. We're back in quorum. Thank you for returning. All right. So we are on Bill 2022-1383, Syracuse Evans and others, amends Title 10 of the Metro Code to prohibit smoking and the use of vapor products in certain age-restricted venues. We have a motion.
You guys okay with that?
All right.
Second.
It's been moved and seconded. Councilman Syracuse, you're recognized. Hello. Oh, yeah, we had to move the amendment. Do you want?
You want to talk about the bill?
Yeah. Do you want to talk about the bill first? And
Let's move the amendment first, or just talk about the.
sure, we can talk about that. Yeah, let's go ahead and move the amendment.
Second amendment.
All right, it's been moved and seconded. You're on your amendment.
Thank you, Chair. The amendment basically clarifies the enforcement ability for health, and I believe that was basically.
It was sort of a belt and suspenders approach based on the legal analysis that wanted to make sure that was clear.
Belt and suspenders, legal definition. Yes, that's how I move the amendment. It's kind of housekeeping in a way, clarifying.
Okay. All those in favor of the amendment? Or do you want to have discussion?
Was that also the amendment that was going to set a date?
Yes.
Now, you're talking about my, yes, that was the other thing.
Yes,
Thank you, the councilman. So you'll see why now my brain's going a different direction. I also talked to a few dive bars, and in working with health and advocates or whatnot, we push it out 6 months to give those kind of places the ability to build a section outside covered or whatnot. So the implementation date would be March 1 of 2023.
Okay.
So
Any other discussion on the amendment? Oh, on the amendment. Okay. All those in favor of the amendment? Anyone opposed? All right. Bill has been moved and amended. Do you want to speak to the bill overall?
sure. So this bill, long time coming. It's not very often where we can stand here and say, thanks to the state legislature, that we have the ability to have this authority to do this. It's time. It's not only a public health issue, it's good for business. The data is crystal clear that you remove smoking and revenues go up. So it only really affects 20 to 25 maybe businesses around the county, I believe.
We're not entirely sure, but there's more than that, but most of them don't allow smoking.
Right.
They're 21 and up.
I've even heard from a couple constituents countywide that have said that thank you for doing this. I didn't want to do it, so thank you for doing it so I can make the change. Where we are a little perplexed on this is based on this one new business that's been open 1 month called Buds and
Brews.
Buds and Brews.
There's another one called the Holistic Connection as well.
So I'm not anti-cannabis, I'm not anti-vaping, but I'd like, Tom, would you be okay with speaking to this and just give some input?
So the bill was primarily aimed at tobacco products. And it's fairly clear cut where those are, and I think we would have a relatively easy time dealing with that. When the Non-Smoker Protection Act passed in 14, 15, whatever it was, there was an educational component that went on for 6 months or so, which is why we're absolutely fine with delaying the onset, because you really need to tell everybody what the rules are before you start taking any kind of action. But there are some not fish or fowl kind of enterprises like this gentleman's, which is not really, they're not vaping.
Can we explain it before you cast aspersions about what we are, Tom?
No, we can't.
I'm not casting aspersions on anybody. It's just, it's not smoking tobacco. And so it's a different animal. And it's unclear as to what that would do to this gentleman's business.
Not to help you out, so being a
So
license would be probably a good thing.
he has asked that we have a further conversation about this, which we'd be happy to do, and it's up to Jeff if he wants to do that. I think that would be reasonable to make sure we're not being unreasonable.
The intent of this was not to hurt any small business, whatever is new. So Jamie Kent is here, who's been the main driver of this at the state level to get this passed. His efforts are extraordinary. As you know, getting something like this passed the state legislature to allow local municipalities to do this is just extraordinary. Did you want to add anything before?
Yeah, I think, I've told a lot of you my story already about my artist that's battled asthma my whole career, so playing in a smoke-filled bar has been a nightmare for me. I've lost my voice halfway through shows. I've had to cancel the next days because of it. Had my merch all smell like cigarettes and try to sell a shirt when it smells like merch, but like cigarettes. And this has been quite the process for me, going from an artist to lobbyist in the course of a year and a half, and learning the ins and outs of the state legislature to the city council here. We've really tried to be reasonable along the way. The thing that kind of throws me here is when when we've been working on this for 2 years and been open to conversations with people, and then they appear the day of something, that always kind of makes me a little like, oh, why today? But again, we always really want to be reasonable too, and just know that we're the music and hospitality community here are a point of pride and a big economic generator for the city, and it feels like we should be protected in the same way that all other Tennesseans are protected, and have the same workplace guarantees about smoking or vaping or whatever. If you can't do it in most workplaces, why should you do it in ours?
You've done amazing work. So where I am is I am going to move to defer this until September 20th. I am not going to be here on September 6th. Where I'm okay with this is because ultimately we also have this amendment that says it's not going to be effective until March 1 anyway. All right, so I'm going to defer this until September 20th. We don't even know if we legally have the authority to amend this based on what the state authorizes us to do. So that's one thing that the council staff needs to figure out, so that whether I can actually do an amendment or not. So we're gonna work on it for one business, but it's not the intent of this legislation to hurt a small business. So I would ask for a deferral to September 20th.
Okay. Councilwoman Gamble, you had your hand raised. Did you want to ask a question before we?
Yes, thank you. I guess I wanted some clarification. When certain age restricted, we're talking about 21 and older. And does this include hookah bars? Can somebody speak to that?
Yes, it would.
Okay. Okay, and so the idea is to have that kind of activity done outside or in a shelter place? I guess, just clarification and for the viewing public.
We got until September 20th.
Okay.
To figure out another,
So then maybe that's another thing that we should look at.
Sure,
Okay,
sure.
all right, thank you.
Okay, Councilman Rosenberg has a question.
Thank you. I was wondering if Councilman Holland could just say what this business is and what it does.
Yeah, Buns and Brews, and this is Joey Fuson. He's the owner. We're not trying to come in here and torpedo somebody's bill. We're trying to protect a small business that's locally operated and does not allow tobacco. But it's an age-restricted venue, and everything they're doing is tied to an age-restricted venue. Mr. Kent won't be singing at my client's bar or restaurant. It's not allowed. Not going to happen. But this bill does negatively impact his business, and I'll let him describe it for you.
Sure. Yeah, my name is Joey Fuson. I'm an attorney here in Nashville. Grew up here. born and raised here. I own a company called Hemp Law Group, and so in 2018 when the Farm Bill passed, and actually before that in 2015 when we had the pilot program here at MTSU, I became the person that represented a lot of people in this community. So I represent producers that grow hemp in town. I represent dispensaries that sell it to retail, the retail space. And we've now opened, I'm part owner of a bar called Buds and Brews. It's a bar and restaurant and a vape lounge, so people can come there, buy vape products, no tobacco products. They're vape products that are hemp-derived cannabinoids, and they can consume them on site through vape taps or vape pens or any kind of vape accessories. There's also dispensaries all over town. We represent the Holistic Connection, and they have one in Belmead, they have one on 8th Avenue, and there's 13 across the state. There are also several others where you can come in, similar to a smoke shop, and buy these products and consume them on site there. So these are the different venues that, if you look at the bill, I believe it would ban that activity where people come there, and it's different. People are coming there to do that. There's no smoking allowed. There's no cigar allowed. There's actually no smoking of hemp flower allowed except on the patio. So these are vapes that people are using at the table that ask to use them. People come there, and when you go in there, there's a retail store there. You can buy the vape products and buy the accessories. We only sell products that we not only grow from the seed all the way to the table. So everything we do is regulated, similar to what we were proposing at the legislature in March to try to regulate the hemp industry, which never got voted on. But the 21 and over, child-proof packaging, testing at every level, all that stuff. And nobody there is, everybody there working is 21. They're all being carded as they come to the facility at 21. So it's just very different than, as I believe, the focus of what this mission for the last couple of years has been, which is to protect these artists that are, I'm assuming down in these bars where people are smoking cigarettes and consuming that as it's rising up and hitting them in the face and making it difficult for them to perform. But this bill captures our businesses, so that's why we're here. And I hate that it's at this time. I wish it was earlier, but this is the second we heard about it, we came running. So.
All right. Any other?
Does that all feel accurate to you, Councilman?
Perhaps the chair could schedule a field trip.
There's a Holistic Connection in Hermitage, not in my district. All right, Councilmember Nash.
Back to the hookah bars, we might want to look at that. That's kind of a cultural thing, is my impression, and maybe one of those things that we want to exempt. And I don't know, there's a lot of musicians playing at the hookah bars, but I think they might get wound up in that. Just a thought.
We'll make note. Thank you, Councilman. Tom will make note of looking at hookah bars and vapor lounges.
Yeah,
they
are
on the list.
The outliers that we have to consider.
Okay. All right, thank you.
All right, any other discussion? We've got a motion to defer till September the 20th. All those in favor? Anyone opposed? All right, we will move to defer till September 20th. Thank you. So I do have a couple of announcements. I always have announcements. It's my last meeting, so I've got announcements. So tomorrow, thank you to Councilwoman Gamble and Councilmember Taylor for leading the way forward. So tomorrow, Wednesday, 8/17, the Public Health and Safety Committee at 5:30, we're having a special meeting on emergency communications, so 911, 8600, Commander Gilder, and I will be there to speak to any questions that come up with MNPD. And then on Saturday, we have another ROPES, which is the Regional Overdose Prevention Specialist Training at the Madison Library from 11:30 to 12:30. That is open to the public. And I always want to ask you when you're here, what's up with monkeypox? What's up with, what are we talking about, like with polio that other states are seeing? So where are we with these things?
In-ray monkeypox, we're against it.
Yes.
We have taken one of our big meeting rooms, or 1, 2, or 3, depending on how you put the dividers. We've reserved one of them for at least the remainder of the calendar year as solely a monkeypox vaccination site. They're out in the community. We learned a lot from COVID about getting vaccines out in the community. They're out in the community with those now, and we will have a dedicated site for at least for the rest of the calendar year for vaccinations. Outreach is difficult. It can be a hard community to get a hold of, but we're working on that, doing the best we can for that. The word's getting out, I think. We had, last time I checked, we were up to 24 cases, I want to say. Still primarily MSM in Davidson County, most of everywhere really so far. That's where that is for right now. Polio We're also against that. There's a vaccine for that.
It's been around for how long?
Been around for a long time, and we would encourage anybody that hadn't had it to get it.
And I know I asked Leslie Waller about when she sent out her report about COVID and wastewater testing, that some states are starting to look at wastewater testing for monkeypox.
Yeah.
And we are not there yet, I know, but is that on the horizon
We may,
potentially?
it's an excellent surveillance tool just to see what's in the community. I know a lot of the polio that they're talking about has been found that way through wastewater, or the prevalence has been indicated that way. I don't know where they are exactly doing that. It is something we can do, though, and they may well do that. I'm not sure.
Okay. And are there any announcements coming out tomorrow that you will have missed the opportunity to share with us first in this committee that you're aware of? Any announcements coming out tomorrow that I will say, Tom was just in our committee and didn't tell us anything about it?
No, I don't know what it is. But they don't tell me everything.
I'll email you tomorrow if I see something. So, all right. Oh, yes, Councilmember.
I remember getting the polio vaccine. Really?
I know.
I was in Kelly's office. But that said, that was several years ago. And is there
a booster?
Will there
That's a good
be
question.
a need for a booster?
I don't know. That's a good question. I need to ask that for my own purposes.
I probably had that 65 years ago.
If you find that out, would you disseminate that information to, okay.
And I know you're doing outreach, but this tends to be a disease that is primarily, at least leaving news amongst the homosexual community. Are we reaching out to Nashville Cares, Streetworks, and some of those groups?
We have avenues in the various and sundry communities, and we're going down all of them.
All right, well, thank you. It was a pleasure working with all of you as chair. I really appreciate everybody's support.
Good question.
Oh,
I came in late, so
sorry.
I didn't hear
Yes,
who our
please.
guest with us today.
We didn't recognize them, so this is good timing to ask if you want to ask.
Yes, I'd love to. I always like to see
If you
young
give me
people.
1 second to pass them before I get to it. I apologize.
No, that's good.
I saw y'all's Mahari stuff.
Oh, yes.
I get to another.
I always welcome opportunity for young people to.
So I'll go first. I'm Charles, and we're all Mahari medical students. Came down to dive into public health stuff. I'm very interested in public health, so I wanted to see.
I'm Maya. I found out about Smoke Free Nashville coming here because I wanted to get involved with the AHA chapter here in Nashville. Yeah, so.
I'm Joliana, and Maya let me know through, we have a cardiology interest group at our school, and she shared it in the group, and I also want to get involved in public health, so.
I'm a Nashville native too, so.
We need you to go work for the health department.
Yeah, go work for the health department.
Be here.
Maybe one day, right?
Well, welcome. Thank you.
Yes, thank you for coming.
Thank you for having us.
Thanks. With that, we're adjourned.
All right. Good job.